Hello friends, sciatica is very common problem that patient is approaching to the clinics. So there's been so many causes of sciatica. The pain, most of the time people are coming to and say that the pain is starting from the lumbar region in the buttocks and it radiating down to the thighs and the legs as well. So these are the very common symptom of sciatica, and one of the major cause of sciatica is this prolapsed disc. So there has been number of vertebrae in our vertebral column, and sometimes this vertebra there has been some disc is there in between the vertebra, and this disc whenever the gets herniated out, and the sciatic nerve root gets compressed, then this starts inflamming and this causes the pain, and this pain is typically radiating towards the thigh that already I'm talking about. So this is the very prominent symptom of sciatica. So before treatment we have to rule out, so what are the causes of sciatica and which are the probable thing that we should do in the sciatica. So definitely the very important thing that we have to rule out what are the causes of the sciatica, because sciatica itself is considered to be a symptom, or sometimes it might not be a sciatica, it might be some other disease as well. So whenever you have such kind of a pain, so you need to approach any consultant that to rule out whether it is a very serious disease or not, or which kind of a treatment that we can seek for this kind of complaint. So most of the time, I already spoken about that sometimes this gets herniated and this causes pressure symptom, and due to that inflammation happens and the pain is started. Sometimes the bone, that is spine, gets calcified by another this calcium deposit, and which also create some pressure symptoms over there, and which may be also responsible for this kind of a pain. There's been another common factor, that is trauma. If there's been so many patients, they have fallen from the bikes or any accident, and they have injury to their spinal column or sciatic nerve, they also are vulnerable to inflammating these kind of a sciatica, which also one of the common factor for this kind of a sciatica pain. So what are the treatment that is really necessary in these cases? So rather treatment, I'll say that management is very important in the case of sciatica, because exercise are playing very greater role to cure this kind of sciatica. So definitely Surya Namaskar will definitely going to help you to relieve the most of the symptom of sciatica. Then there has been asana called Bhujangasana or Sarpasana is also going to help you or reduce the most of the pain. Next, third important thing, that heating pad also going to relieve your 70 to 80% of pain. And still, if it is not better, then you have major role of homeopathic medicines. After that, there are the number of homeopathic medicines available for sciatica, but we have to need is that which kind of a pain is there, how this pain is started. We have need to evaluate whether it is sciatica or not. First of all, if the pain is not settled by all these things that we had talked before, and if it is not getting better after exercises and hitting pad, then definitely you have to approach any homeopath or any consultant physician, that we have to rule out which are the responsible causes for your disease. So after that we can take decision to which kind of treatment should be suitable for you. Most of the time, if this gets herniated and which is getting prolapse and making much pressure over your spinal column, then there's been also surgery is also needed, but it is not in 99 cases. There's been 99% of the cases homeopathic medicine itself going to cure your sciatica for a lifetime, because it's very there's been a number of medicines that has been available in homeopathy. There's no need to take any kind of a painkiller on all these things. Don't do that. Take homeopathic medicine, go to homeopathic consultant, take these simple medicines, and do the whatever they giving the exercises and all these things will I say definitely going to get beneficial relief from this kind of medication. So There's been another things that you can do, that is one test is that we have to consider to diagnose the sciatica, that is straight leg test. So yeah, in this test you have to raise your leg without bending in the knee and straight forward up to the 90 degrees. We have to see that whether the pain is present over there or not. So it is a test that we have to do. In most of the cases, radiological diagnosis is needed most of the time in the sciatica. That is, MRI is considered to be a gold standard diagnostic test in sciatica, because MRI clearly visualizes all these things, that is nerve, bone, and ligaments, and all these things that we cannot do with X-ray. So MRI is the gold standard for the sciatica. So I hope this video is helpful for you. So thank you so much.